This is Mom Squad Pod, your weekly update on tips, tricks, and all things parenting with Maureen Kyle.
Hi, everyone. Thank you for joining us on Mom Squad, the podcast and streaming show where we talk all things parenting. And this week, Clueless star Alicia Silverstone is making big headlines again. Maybe you've seen it. So years ago, back in 2012, you might remember this. She took heat for pre-chewing food for her son, like he was a baby bird. Now, during an interview, she said that she's co-sleeping with her now 11-year-old. They sleep in the same bed. So that shocked a lot of parents. There's a lot of comments going around the internet and a lot of reaction. And before we get into mom shaming and talk about how to help get your kids out of bed, let's pull the curtains back on our own bad habits, because I think we've all had some. And joining me today is Jenny Jordan, our executive producer, mother of two, the one I come in pretty much every morning and go, oh my gosh, I'm failing at parenting. So I had to pull Jenny in on this one.
Yes.
And you're the one who first saw this and you sent it to me. So
I said, we got to do something on this. I mean, some people call it co-sleeping. I call it survival sleeping. Like sometimes they crawl into bed and I just don't have the energy to carry them back to bed, or they're just having a hard time. And it's like, well, we need sleep here.
Right.
Let's go.
Right. And yours are 6.
I have a 6 and a 3-year-old.
Yes.
So my 6-year-old is pretty much in her own bed most of the time. And it's more if she is, it's like, oh, how come he gets to sleep in there? You know, the jealousy thing.
Right.
But my 3-year-old, he's a tough one to crack. He's gonna be my tough one.
We've all had it. I don't know any parent that hasn't had at least one of their children, and maybe you are one of the lucky ones who hasn't. I mean, our middle, so my 6 turning 7-year-old Millie, she was the one who would, like, we would just wake up and she's there. Like, we don't know when she came into the bed in the middle of the night. And I think that with a lot of things, you always think, oh, well, they're not going to be 11 years old and still doing this. Or
hope.
like, they're not going to be going off to college and still doing this. And there's so many other things, not just co-sleeping, but there's things like potty training. And you think, well, they're not going to be wearing a diaper at age 11, and they're not going to be using a pacifier or sucking their thumb. So there's those little habits. So I think the initial reaction when you see Alicia Silverstone say, oh, he's 11 and we still co-sleep, the first reaction is sort of like, is that appropriate? And then you're thinking, oh my gosh, my kid is still doing this at 11, and what am I going to do?
I mean, I'm thinking of my 6-year-old's little body kicking me. I'm like, sometimes I feel like we're Willy Wonka in a bed. It's like the whole family's sleeping there. And I'm like, there's not enough room. You have an 11-year-old that's even, bigger. How much space are they taking up? But you're right. I think one of the big things I remember is like 1 year old, you cut off the bottle. Yeah. Well, that's such a soothing thing for kids, and whether it's breastfeeding or bottles, or we're not going to get into that whole debate, know?
Yeah.
But, I just think that it's like, well, you're not going to cut your kid off cold turkey, right? There's times when it's storming and they have a bad nightmare and they need you to be in there, or they want to soothe. And that's how you might need to teach them to soothe, but sometimes it's the middle of the night and they need to be there, right? Sometimes their first birthday and they need a bottle to get to sleep. And yes, they do wean off of it. That was one thing. Everything's a season, right? Mm-hmm. Like, it feels like you have to do something right away, but it's just a season, and they do seem to grow out of it. At least so far, so good.
Well, with all of this, there's always an expert.
Yes.
And so let's say your kid is co-sleeping, either as a toddler or maybe who's a kid who's just getting way too old to climb into your bed. There is an expert for this. I talked to Dr. Carolyn Ievers-Landis. She's a pediatric psychologist who specializes in sleep. Take a listen to what she had to say.
I see people that their children have insomnia. So the reason that I see kids co-sleeping, I think is a little different than for Alicia, because I think for her, it's more of this like idea of the attachment parenting idea. And the children that I see, they're co-sleeping because of anxiety. So I think when we're talking about co-sleeping, we should really kind of determine why is the child and the parent co-sleeping.
So it's not, everybody's rushes to judgment because we are told, that kids should be doing certain things by a certain age, but that wasn't surprising to you that there was a co-sleeping situation with an 11-year-old?
I think that, cultures are different all over the world. And in many cultures, we don't have multiple bedrooms and multiple beds, and the whole family might be co-sleeping. So I think, in our culture, it's not as normal because in our culture, it's the supposedly good thing to do to have everyone in their own bedroom. And with that said, there are some issues with co-sleeping that we can kind of go over, regardless of your child's age.
Yeah, what are some of those issues? Is there any danger at that age? I think that's the first thing we have to start with. And then what are the
Well, obviously, as infants and, young toddlers, it's not safe because we are concerned about SIDS, and we're concerned about suffocation, or we're concerned about a child falling off the adult bed or something. But we're talking 11 years old. But there's such a thing as mutual arousal, so that we move around in our sleep, and every sleep phase except for REM, when we're dreaming and we're very still. So you have to think about the more people you have in bed, or animals, I should say, the more people can wake each other up. We have natural wake ups, or just little brief arousals every hour and a half, but then you have someone else in bed with you, including an animal, a child, a spouse, a partner, and we wake each other up at different times. And some people, when they're woken up, when it's not their typical little arousal, have trouble falling back to sleep. So we can really affect sleep efficiency, particularly for people that their sleep is disrupted easily.
What about another thought I'm having is for the parents who maybe now their 4 or 5-year-old is still coming in, and it's more of a habit that they're coming in sleeping. Maybe everybody's having trouble sleeping. Is there an underlying issue there with separation anxiety, or should a parent start to think, gosh, my kid is kind of old for coming in and sleeping with me every night? You mentioned anxiety, but is there any other indicator that there might be something that you need to look at more in depth?
I think you've hit the nail on the head, is that if you are sleeping because your child is anxious, then you're accommodating for their anxiety. You're not helping them get over that. You're not helping them move on from that. Just like if your, child is afraid of the water and you never took them to the swimming pool or encouraged them to swim, right? If you're always like, oh, they're afraid at night, so I'm just going to always co-sleep. Well, then you're not working on behaviors of how to self-soothe, how to feel comfortable by yourself in a bed and things like that, which are important, for your child to learn those. So I think in this instance, again, with Alicia, it wasn't about anxiety. It was more kind of about a parenting philosophy. But if this child was so anxious, even at 11, I have teenagers in my practice who still could sleep because of anxiety. And then they're going off to college, literally, and they're like, some of them won't go because they literally cannot sleep by themselves. So, and we know from research that accommodating for anxiety just prolongs the anxiety. It doesn't treat the anxiety.
Yeah. So what's the first step as a parent? If you want to start to get them out of the bed and getting them sleeping on their own, sleeping in their room, whether it's anxiety or just toddlerhood, I mean, what's a step that a parent can do, or the easiest, healthiest way to do it?
Okay, and I just want to preface this by saying, if you're really having a lot of struggle with anxiety, please talk to your child's pediatrician. And there's people like me who have their diploma in behavioral sleep medicine or who are behavioral sleep experts that can help you. But for your typical child with typical, maybe just a little bit of anxiety, then some of the things that I'm going to recommend are things you could try. So one of the things you can do is sit with your child at bedtime. And I wouldn't say cuddle with them in their bed, because a lot of the parents I see do that, but just sit next to the bed and be like, I'm here, and wait for them to fall asleep and then leave. That's really kind of a first step if you're kind of in that habit of sleeping in the same bed. That way you're getting them used to their room, the environment. They're still having to kind of self-soothe because you're not cuddling with them or rubbing their back or doing anything like that.
And so then you mentioned calling the pediatrician. Will there be a red flag of, will the pediatrician, or would you be able to tell somebody this is more than just a stubborn toddler? This is something a little bit more serious?
Well, I think for some children, I mean, some children do have sleep disorders. You know, you can have insomnia, and some children need less sleep than others. Some children, for whatever reason, don't make enough melatonin or they make it later. So there might be things in terms of the timing of when your child sleeps, the timing of when they get up, the regularity of their sleep period, napping that can be influencing how easy it is to fall asleep. There could be ADHD, there could be maybe they're on the spectrum. I mean, there are so many different things that can interfere with sleep, which is why if you do some of these simple things, like sitting next to them, like escorting them back to bed when they wake up, maybe even have a little reward system so that if they slept by themselves, they would get to pick something out of a treasure chest in the morning, which we found effective. But sometimes I have to add all these other pieces to that.
Yeah. This also brings up the whole conversation of, I mean, whether it's sleep or using a pacifier or sucking a thumb, or I feel like there's a million things in childhood that we always have in our minds as parents, and then we get judged if it goes a little too long, but like, oh, by this age, they shouldn't be doing XYZ. Are there, I mean, do we have to follow a natural timeline? Are there things that, you know, is that a healthy way to approach childhood and milestones? Or do you think kids work at their own pace? You know, when should we be concerned when something goes too long, if that's even a thing?
I think that is so important because we guilt parents. And, you know, I think especially as moms, I guess dads too, but particularly moms, we're always guilting ourselves and second guessing ourselves. But I think you can think of it, is this really harming my child? Or is this harming me? Or is this harming my partner? Right. So if your sleep is disrupted, if mom's sleep is disrupted and you can't go back to sleep because this kid is kicking you, right? I mean, which happens a lot, then it's hurting you and you need to work on it. Let's say that there's not enough room for your spouse or partner and they literally are sleeping in another room or on the couch, which happens a lot to some of my patients. So what about your privacy? What about your space or private space? Maybe you don't have time for any intimacy because you have a kid in your bed, right? I mean, so there are ways in which it can affect you. And maybe it is anxiety and your child, you're just accommodating and you're not helping your kid kind of get over that or treat the anxiety because you're just like, oh, you poor baby, come here for every little thing. You know, just like the pacifiers that pushing their teeth out. Are they not talking as much because they have a pacifier in their mouth? It's just like everything you're trying to see, are there detriments? But if it's like perfectly fine, your kid isn't really anxious, you're both sleeping well, you just kind of are enjoying it for now, then I don't think the sleep world cares, you know, as long as your child, you know, they're not a toddler or an infant.
I loved her insight just because that really hits the nail on the head. If it's not harming anybody, then what's wrong with the habit? But if it's starting to hinder development in any way or your happiness or health, that's when you start to look at things. So I loved her putting it in that framework because really, I mean, like you think of something like potty training. It's like, well, that's not really hurting anybody if they're taking their own time. I mean, it's driving you crazy. But then when you look at something like the pacifier, where I've gone later to the dentist and they're like, oh, did she use a pacifier way too long? And it's like, yes.
Guilty.
She did, right? Guilty. Now I'm going to an orthodontist. So yes. I like putting it in that kind of framework because then I feel like that's more helpful.
Yes, definitely. Because some kids they have their own timelines and you know your own kid. You know if they're coming in to the bed because they're anxious because it's back to school and it's a new routine and, you know, they just need that soothing thing. And you know when they're just trying to avoid going to sleep, you know? And so I think everything's a little bit different. And that pacifier is a tough one. That is a tough one. It's one that I was like, I'm never even, and you know, she brought it up, the guilt, right? And it's like, as a mom, before I was a mom, I was never going to use a pacifier.
Right.
My kid would never sleep in our bed. My kids would wear the clothes I picked out for them. here we are.
Right.
Never happens, right?
Right. And it starts right from the start. I remember those birthing classes where it was like, you know what? I'm going to do this all natural. I'm not going to get drugs. I'm not going to get the epidural.
Yeah.
And then you're in the situation. You're like, whatever makes it work.
Right.
So,
I mean, it's just everything is much harder than you expect it to be. And I think you have to give yourself grace, right? Like, and when it comes to that guilt stuff, you know, my favorite quote, Amy Poehler's book, she wrote, you know, good for her, not for me.
Yeah.
So when it comes to parenting styles, it's like, if that helps you, good for you. You know what I mean? Like, but you know, my kid's gonna get a popsicle at 10 a.m. I can't stop it.
And so now that we've put it into this framework, I feel like you think about Alicia Silverstone's situation a little bit differently. I mean, there's certain things, as you heard the doctor mention, that's developmentally inappropriate. So like once he starts to hit puberty, I think he's going to be sitting at that lunch table. And the moment he's like, what, you don't sleep with your mom? Well, you know, like I do. What are you talking about? I think that's going to be the tide turning. So I feel like everything rights itself. But, you know, a writer, I pulled up some article and a writer pointed out she's not pushing the view on anybody else. No. She's not saying everybody should be co-sleeping with their child into preteen age.
Right.
So I don't know if like now that I've, you know, the initial reaction to her saying that and now that I've delved a little bit deeper, I don't know if I have that big of a reaction. It's sort of like, you know what, you do you.
Yes, and our kids are a little bit younger than that.
Yes.
So it's sort of like, I wonder how I'll feel when my kid's 11. You know what I mean? I don't know how that would work out. But Kourtney Kardashian says that she does it too. And it's all about that attachment parenting style. And what I thought was interesting was in one of the interviews with her, she said, I didn't mean to do this parenting style. It's not like I signed up and was like, you know what, I think I'll do this check. It just sort of happened. And I think that's what happens for a lot of families. Everyone has different situations. And so you just sort of fall into, you know, the style or your personality or, you know, like I said, beforehand, I would have checked one box and now I'm checking a whole other box. So,
well, and a kid's personality too. I mean, even when we were sitting here before, I mean, some kids, they just, like my 6-year-old, she gets freaked out at night. And she's the only one out of the 3 that she just kind of like has that, I don't know if it's anxiety at night, nothing severe, but she does get nervous, you know, like she'll have a bad dream and she wants to be in there. So here she is in our bed, hopefully not going to happen until she's 11, but it's a kid's personality too that you cannot predict.
Right, right.
All right, well, hopefully that helped all of you in dissecting and unpacking Alicia Silverstone's statement, and then also a sleep expert. So hopefully you can use some of her advice to help get the kids out of bed. Jenny, thanks. It's always great to have you join in.
Thank you. I wore my mom bun in honor of the mom squad.
I know.
Alicia, if you want to be part of our mom squad, give me a call. We're happy to have you.
Yeah.
So we appreciate it.
She would have some good insight. But seriously, behind the scenes here, Jenny is the one I'm always running to going, oh my gosh, what did I do wrong? what am I going to do? So thanks to all of you for listening to Mom Squad Pod. We'll see you right back here next time.
Thanks for listening to Mom Squad Pod with Maureen Kyle from WKYC Studios. Subscribe now so you never miss an update. And find more on everything you heard here on WKYC.com and on the WKYC app.